Carotid artery stenosis refers to the narrowing of the carotid arteries, which are the major blood vessels in the neck that supply blood to the brain, head, and face. This narrowing is often caused by the buildup of plaque on the inner walls of the arteries. As the plaque accumulates, it can restrict blood flow to the brain, increasing the risk of stroke or transient ischemic attack, also known as a mini-stroke. Vascular surgeons play a crucial role in diagnosing and treating carotid artery stenosis. Vascular surgeons use various diagnostic tests to assess the severity of carotid artery stenosis and determine the most appropriate treatment. These tests may include ultrasound imaging, magnetic resonance angiography, computed tomography angiography, or digital subtraction angiography. In cases of mild to moderate carotid artery stenosis, vascular surgeons may recommend lifestyle changes and medications to reduce the risk of complications. This may include adopting a healthy diet, quitting smoking, managing blood pressure and cholesterol levels, and taking antiplatelet medications or anticoagulants to prevent blood clots. A carotid endarterectomy may be done as well if needed. This surgical procedure involves removing the plaque buildup from the inner walls of the carotid artery. During the procedure, the vascular surgeon makes an incision in the neck, exposes the affected artery, and carefully removes the plaque. The artery is then repaired, and the incision is closed. Carotid endarterectomy is typically recommended for individuals with significant carotid artery stenosis and a high risk of stroke. In cases where carotid endarterectomy is not feasible or appropriate, vascular surgeons may perform carotid artery stenting. This minimally invasive procedure involves inserting a stent, a small mesh tube, into the narrowed artery to help hold it open and improve blood flow. The stent is typically delivered to the site of the blockage via a catheter inserted through a small incision in the groin. Vascular surgeons monitor patients with carotid artery stenosis closely, conducting regular follow-up appointments and imaging tests to assess the effectiveness of treatment and detect any signs of progression or recurrence. Overall, vascular surgeons play a critical role in the management of carotid artery stenosis, employing both medical and surgical interventions to reduce the risk of stroke and improve patient outcomes. Give us a call at 480-668-5000.